Have you ever noticed how almost everyone assumes that if you want lower blood pressure, the answer is obvious? Walk more, jog more, get on a bike, do more cardio. And to be clear, cardio is good. It helps your heart, your lungs, your endurance, your mood, your metabolism. But what if I told you that when researchers compared the major exercise categories head to head across 270 studies, the most effective exercise for lowering resting blood pressure was not jogging, not cycling, not interval training, not even traditional weight training. It was a static exercise, an exercise where you barely move. That sounds wrong at first. It sounds like one of those fitness headlines designed to get your attention and then fall apart the second you look closely. But this one is different. Because when you actually examine what blood pressure is, what makes it rise, and what kinds of stress the cardiovascular system adapts to, the answer stops sounding strange and starts sounding almost embarrassingly logical. And that's what I want to do in this video. Not just tell you the answer in one sentence and move on. I want to show you why this answer emerged from the data. What is actually happening inside your arteries when you do this kind of exercise? Why the old just do cardio advice is incomplete, and what the real practical version of this looks like if you wanted to build it into normal life. Because once you understand the mechanism, you stop treating exercise like random movement and start seeing it as targeted biology. And in the case of blood pressure, that changes everything. So let's build this from the ground up. The first thing we need to get clear on is what blood pressure actually is, because a lot of people hear the numbers 120 over 80, 140 over 90, and they treat those numbers like a kind of weather report. Good today, bad today, up a little, down a little. But those numbers are describing force. The pressure your blood is placing against the walls of your arteries as your heart pumps and relaxes. The top number, systolic pressure, is the force when the heart contracts and sends blood out into circulation. The bottom number, diastolic pressure, is the force between beats when the heart is refilling. And when those numbers stay too high for too long, your blood vessels are living under constant mechanical stress. The arterial walls stiffen, the heart has to work harder. The risk of stroke, heart disease, kidney damage, and other problems rises over time. That part is well known. What's less appreciated is that blood pressure is not controlled by one thing. It's not just how hard your heart pumps. It's also how tight or relaxed your blood vessels are. It's your nervous system. It's your kidney function. It's sodium balance. It's stress hormones. It's sleep. It's body weight. It's insulin sensitivity. It's how responsive your arteries are to signals telling them to dilate or constrict. Blood pressure is not one dial, it is a whole control panel, and that matters because different types of exercise affect different parts of that panel. This is where most people make the same assumption. They think the exercise that feels hardest on the lungs must automatically be the best one for blood pressure. That's why cardio has dominated this conversation for so long. If your heart is beating fast, if you're sweating, if you're breathing hard, it feels cardiovascular, so it must be the most powerful cardiovascular tool. Reasonable assumption, but not the full story. When researchers pooled the evidence from 270 randomized controlled trials involving more than 15,000 participants, all the main exercise categories helped reduce resting blood pressure. Aerobic exercise helped. Traditional resistance training helped. Combined training helped. High-intensity intervals helped. But the category that produced the largest overall reductions was isometric exercise training. That word, isometric, simply means the muscles are producing force without changing length much and without obvious joint movement. You're working hard, but you're holding a position rather than repeatedly moving through it. Think of a wall sit. Think of a sustained hand grip. Think of holding tension instead of cycling through reps. And within that research, one of the standout movements, the one that kept rising to the top for systolic blood pressure, was the wall squat, what most people would just call a wall sit. Now, If that surprises you, good. It should. Because surprising findings are often where the interesting biology begins. Let's talk about why a wall sit could possibly have anything to do with blood pressure in the first place. When you lower yourself into a wall sit, your quadriceps, glutes, and core switch on and stay on. The muscles are under continuous tension. That tension compresses blood vessels inside the working muscle. Blood flow becomes partially restricted during the hold. Your body notices immediately. The heart, the vessels, and the nervous system all have to respond to that stress. Then, when the hold ends, that compression releases and blood rushes back through the tissue. That cycle, tension, and release seems to create a very specific vascular training effect. One of the leading ideas is that this kind of training improves the way your blood vessels regulate resistance. In plain English, your arteries and smaller resistance vessels may become better at relaxing when they need to. Another likely piece is improved autonomic control, meaning a healthier balance between the fight or flight side of your nervous system and the calmer rest and regulate side. There's also evidence pointing toward better endothelial function. The endothelium is the delicate inner lining of your blood vessels. It helps control dilation by releasing signaling molecules, including nitric oxide. When that system works better, blood can move with less resistance. And remember, blood pressure is strongly influenced by resistance. If the pipes are tighter, pressure rises. If the pipes become more responsive and less resistant, pressure can come down. That's why this matters. Isometric exercise is not magic. It is not a hack. It is a very specific signal sent to the vascular system, and the body adapts to that signal. Now, I want to be careful here because this is where health content often becomes misleading. The takeaway is not cardio doesn't matter. That would be false. Cardio still improves heart health in all kinds of important ways. It supports aerobic capacity, metabolic health, circulation, and long-term cardiovascular fitness. The real message is more nuanced and more useful than that. If your specific question is, which exercise mode appears to reduce resting blood pressure the most efficiently? The answer from the current evidence is not the one most people expect. And there's another reason that answer matters: time. One of the biggest barriers to exercise is not ignorance, it's friction. People imagine that to meaningfully improve blood pressure, they need long workouts, special equipment, a gym membership, a perfect morning routine, an empty schedule, and some future version of themselves with much better discipline. So they do nothing. Or they keep promising themselves they'll start walking an hour a day next month, which quietly turns into next season and then next year. But a wall sit is brutally inconvenient for that excuse. You need a wall. That's part of why this research is so interesting. The best intervention is not just effective, it is unusually accessible. Minimal equipment, minimal space, minimal time, high physiological return. Let me show you what the typical protocol looks like, because this part is important. In many of the isometric blood pressure studies, the training structure was surprisingly simple: 4 holds of about 2 minutes each, with about 2 minutes of rest between holds, done around 3 times per week. That is not an endless training schedule. That is a very modest time investment. Even if you include the rest periods, you are still talking about a session measured in minutes, not hours. And what's remarkable is that the reductions reported in some studies were not small. Across the broader meta-analysis, isometric exercise training produced some of the largest average drops in resting systolic and diastolic blood pressure among the exercise categories studied. In specific wall squat and hand grip trials, some participants saw double-digit reductions in systolic pressure. Not everyone, not in exactly the same way, but enough to make the pattern impossible to dismiss. Think about how unusual that is. We live in a culture that tends to respect health interventions in proportion to how exhausting, expensive, or complicated they are. If something is simple, people assume it must be weak. But biology does not care what looks impressive. biology responds to signals. If a static hold sends the right vascular signal consistently enough, the body adapts. That is the whole game. Now let's deal with the obvious question. If wall sits are so effective, why hasn't this become common knowledge already? Part of the answer is inertia. Exercise recommendations don't change overnight just because one interesting result appears. Public health guidance moves slowly, and for good reason. It waits for evidence to accumulate. Cardio has decades of support behind it, and it benefits far more than blood pressure alone. So broad guidelines still emphasize aerobic movement heavily, which makes sense. But another part of the answer is cultural bias. We are visually biased toward motion. Running looks like exercise. Cycling looks like exercise. A person sitting against a wall looks like they lost a bet. It does not look like cutting-edge blood pressure management, and yet the body is responding to tension and vascular stress, not aesthetics. There's also a more subtle reason. Isometric exercise is uncomfortable in a way that's psychologically different from cardio. A brisk walk can be pleasant. A bike ride can feel freeing. A wall sit feels like negotiating with your own nervous system in real time. 30 seconds in, you're okay. 60 seconds in, your legs are speaking in complete sentences. 90 seconds in, time stops being a physical quantity and becomes a moral challenge. It is simple, but it is not easy. And that discomfort may be part of why the effect is so strong. The muscles are fully engaged. The cardiovascular system is responding. The nervous system is learning. The vessels are being exposed to a pattern they have to adapt to. But before this turns into one of those videos that sells one move as the answer to life, let me put some boundaries around it. First, the best exercise for lowering blood pressure is still the one you will actually do consistently. Evidence matters, but adherence matters too. A theoretically superior exercise that you quit after 6 days is worse than a slightly less potent exercise that becomes part of your life for 3 years. Second, most effective in a meta-analysis does not mean universally best for every body, every age, every injury history, every medical situation, or every goal. A person with knee pain may hate wall sits. Someone else may prefer isometric hand grip. Someone else may need a walking routine because their main win is weight loss and stress relief. The point of this video is not to replace all exercise with one hold against a wall. It is to show you that for the narrow question of resting blood pressure reduction, the evidence has shifted in a very interesting direction. Third, if someone has uncontrolled hypertension, heart disease, dizziness with exertion, major joint limitations, or is unsure how hard they can safely exercise, that is not the moment to act like a YouTube video is a substitute for individualized care. This is educational information, not personal medical advice. Context matters. Now, with that said, let's get practical, because theory only matters if it becomes behavior. If you wanted the simplest version of this, the version with the least friction, it would look something like this. A few times a week, you find a wall, you place your back against it, you walk your feet forward, you slide down until your legs are bent, ideally working toward roughly a right-angle position at the knees, though many people will need to start higher. Then you hold. And while you hold, you do the single most important thing people forget during isometric exercise: you keep breathing. That sounds trivial, but it isn't. Holding your breath and straining can sharply raise blood pressure during the exercise itself. Slow breathing matters. Controlled breathing matters. The point is sustained muscular tension, not turning the hold into a contest of who can create the most internal pressure. Start shorter if you need to. 20 seconds is better than 0. 30 seconds becomes 45. 45 becomes 60. The research protocols often work toward 2-minute holds, repeated several times, but nobody gets bonus points for pretending they started there if they didn't. The body adapts to progressive exposure. That's true for muscle, for vessels, for habits, for almost everything. And if wall sits are not realistic for you, that does not mean the concept is useless. Isometric hand grip training has also shown meaningful effects in the literature. So has other static work. The exact tool matters less than the principle: sustained muscular contraction, controlled duration, repeated exposure, gradual progression, consistent practice. Now let me compare this with cardio, because I think that contrast helps the whole thing land. Cardio lowers blood pressure partly by improving overall cardiovascular efficiency, vascular health, body composition, insulin sensitivity, and stress regulation. Those are powerful effects, and they absolutely matter. But cardio also comes with a larger time cost for many people. And while it is excellent for general health, it may not always be the most time-efficient blood pressure-specific tool available. Isometric exercise, by contrast, seems to punch above its weight for this one particular outcome. That doesn't make it better in every category. It makes it sharper for a specific job. Think about it like this. If you wanted to improve your ability to carry groceries up 3 flights of stairs, a wall sit is not enough. If you wanted to improve your 5-mile run time, a wall sit is not enough. If you wanted broader endurance, calorie expenditure, or aerobic conditioning, a wall sit is not enough. But if you are asking a tightly framed question, which exercise signal appears especially effective for nudging resting blood pressure down, then yes, the wall sit suddenly becomes a very serious answer, and there's something else here I find genuinely interesting. The exercise most people ignore may be the one that forces them to confront a deeper truth about health change. A lot of improvement does not come from doing more things. It comes from doing the right thing often enough for the body to remodel around it. We overestimate complexity and underestimate consistency. We think transformation should look dramatic. But arteries do not care about drama. They care about repeated inputs. That's why 270 studies matter. Not because the number itself is magical, but because by the time you have that many randomized trials in the conversation, you are no longer looking at a cute little wellness idea. You are looking at a pattern, a real one that survived comparison with aerobic training, resistance training, combined training, and intervals. And the specific exercise that kept surfacing near the top was not glamorous. It was a wall squat. I also want to point out something people often miss when they hear blood pressure reduction numbers. A drop of a few millimeters of mercury might sound tiny if you don't understand the scale. But across populations, even modest reductions matter. The cardiovascular system is sensitive to pressure. Small changes, sustained over time, are not trivial. They shift risk. They change the mechanical environment inside the arteries every minute of every day. This is the same reason sleep, sodium, body weight, alcohol, and stress can all matter even when none of them feels dramatic in isolation. Blood pressure is cumulative physiology. Small levers count. So if you combine a solid exercise habit with better sleep, lower sodium intake, healthier body weight, more potassium-rich foods, and less chronic stress, you are no longer depending on one hero intervention. You are changing the whole pressure environment your body lives in. But I understand the appeal of wanting one place to start. And in my opinion, that's where wall sits become so useful. They are concrete, they are measurable, they are hard enough to feel meaningful, but simple enough to repeat. You can track them, you can progress them, you can fit them into a normal day. You can do them while waiting for dinner to cook. You can do them between tasks. You can do them in an office, at home, in a hallway, in a bedroom, almost anywhere. And that removes one of the biggest lies people tell themselves about exercise. I don't have the right setup. You have a wall. Now, there is one more point I want to make because I think it changes how people hear this whole topic. The goal is not to replace movement with stillness. The goal is to understand that stillness can be a form of training, a demanding one, a biologically meaningful one. In a culture that equates exercise with motion, that's a powerful correction. Sometimes the body changes not because you moved more, but because you held tension long enough for the system to adapt. That is what makes this finding so interesting to me. it reveals a blind spot. We assumed blood pressure exercise had to look like cardio because cardio was the most familiar story. But once the data widened and more exercise modes were compared properly, another story emerged. One where static contractions, especially wall sits, produced some of the strongest blood pressure effects in the entire field. So, what is the number one exercise for lowering blood pressure based on the current comparative evidence? Not running, not cycling, not burpees, not some futuristic gadget. A wall sit. More broadly, isometric exercise training. But in practical, real world terms, the wall sit is the star of the story. And I think that matters for a reason beyond fitness. It reminds us that good health information should update when better evidence arrives. We should not stay loyal to an old idea just because it has been repeated for decades. If the data gets sharper, our understanding should get sharper with it. That doesn't mean cardio is obsolete. It means the picture is more complete now. So the next time someone says lowering blood pressure is all about jogging, remember this. The cardiovascular system does not reward tradition. It rewards adaptation. And sometimes the most effective signal is not the one people talk about most. Sometimes it is the quiet one, the static one, the one that looks almost too simple to matter, until you actually look at the evidence. And then it becomes very hard to ignore. So if this video changed the way you think about exercise and blood pressure, make sure to subscribe to the channel. And if you want, leave a comment telling me whether you were more surprised by the 270 studies, the wall site itself, or the fact that something so simple can create such a meaningful effect. Thanks for watching, and I'll see you in the next video.